Lesson 2. Health and Peace. Tools for Frontline Workers. Introduction. Conflict analysis aims to identify leverage points that have the greatest influence on the system as a whole, making interventions more effective. Conflict analysis is and should be an important part of developing peace-responsive interventions. Failing to carry out conflict analysis could lead to missed opportunities for peace building or interventions that inadvertently fuel conflict. Conflict analysis. Conflict analysis follows 5 principles. 1. Do no harm. The process of conflict analysis can be highly sensitive. Early consultation is therefore needed to understand the risks. This avoids exacerbating conflict and could provide opportunities to promote peace during the analysis. 2. Collaborative. It is important to have a multidisciplinary approach, drawing on technical knowledge as well as perspectives which are close to the people affected. Including people from across the UN system also aids joint strategy. 3. Participatory. Engaging different stakeholders is crucial to gaining diverse perspectives and enhancing objectivity, reliability, and credibility. This avoids accepting simplified mainstream narratives. 4. Flexible. Analyses should be consistently updated to maintain a timely and relevant understanding of the situation. 5. Iterative. Given the complexity of conflict settings, the analysis process cannot be a binary input-output procedure and requires multiple iterations. Conflict analysis identifies the dynamic forces driving positive and negative trends, broadly categorized as conflict drivers and peace engines. Peace engines are resilient elements within society that mitigate the proliferation of conflict and strengthen foundations for peace. Conflict sensitivity. Both working in and working on conflict require conflict sensitivity. Conflict sensitivity is a lens, allowing humanitarian and development interventions to avoid harmful consequences of decisions. Given that all decisions are value-laden and political, a human rights perspective must be integrated into the analysis and programming stages to ensure interventions do not have unintended negative effects. Peace and conflict dynamics. Core questions. What consequences may conflict triggers have on the causes and key stakeholders? What are the main mechanisms and logics driving the conflict? Are there any redundancies in behaviours and actions? Can specific patterns be identified in the occurrence of violence? What likely scenarios can be developed from analysing the conflict profile, causes and actors? What are the main capacities for managing conflict? Response to health emergencies. The way forward means leveraging technical expertise in a neutral position to facilitate health diplomacy by bringing different parties together in collaboration, influencing the design of inclusive national health policies, advocating for health equity, and monitoring and reporting on attacks on healthcare services. Risk management. While health interventions in crises entail risks, contributing to peace, particularly outside formal peace processes, is not without danger. When carrying out peace-responsive programs, the following risks should be considered. Inequitable delivery of benefits, real or perceived, could worsen relationships within the community. Engaging with competing authorities could reinforce polarization and undermine the image of the United Nations as an impartial body. Engaging with armed groups could lead to retaliation in the form of attacks on healthcare facilities or personnel. These risks broadly fall into 2 categories. Stakeholder engagement may be negatively perceived, undermining credibility, neutrality, and impartiality. Interventions may have a negative impact on staff, healthcare professionals, and access to healthcare. Field implementers have the responsibility to weigh the benefits and risks to take appropriate action. Communication must always emphasize apolitical humanitarian principles and equitable access to healthcare. What field implementers should do depends on the level of risk present at the time. Extreme risk. Avoid risks, recognizing there is no space for effective implementation in this context. High risk. Transfer risks. Identify a specialized neutral partner to carry out the intervention. This is necessary if the activity has high benefits and not implementing it would be harmful. Medium risk. Mitigate risks, for example, trust-building measures, including clear communication and explaining the evidence base for interventions. Low risks. Accept risks. Stakeholders. Implementing peace-building health initiatives requires working with different stakeholders that can be categorized into one of three tracks. Track 1. High-level leaders. The United Nations is seen as a legitimate third party to facilitate health dialogue and diplomacy. Track 2. Health actors, for example, health NGOs, and other groups, for example, religious organizations. These are often influencers, with legitimacy among leaders and community members, and have the potential to either address or fuel conflict drivers. Track 3. Community mobilization. Successful interventions during emergencies require good communication with community members, while community participation in health system strengthening builds inclusive societies. Peacebuilding. The WHO programmatic approach to peacebuilding involves 5 key steps. 1. Situational analysis. 2. Conflict driver analysis. 3. Risk management. 4. Planning. And 5. Programming. Case study: the Eastern Mediterranean region, EMR. The persisting crises in the EMR threaten health and peace. The region comprises 21 member states and the occupied state of Palestine, and varies in income, political stability, and social stratification. 9 of the 39 countries on the World Bank Harmonized List of Fragile Situations for 2022 are in the EMR. The EMR faces an unprecedented scale of emergencies, mainly due to political conflict in several countries. Over 62 million people across the region need healthcare. Nearly 30 million displaced people, over half of displaced people globally, originate there. The region also hosts the highest numbers of children malnourished due to emergencies. Weakened health systems face shortages in personnel, vaccines, medicines, and supplies. Lack of fuel, power, and safe water worsens health service provision. Conflict in several countries has increased trauma injuries and the risk of infectious disease outbreaks. Escalating conflict and massive humanitarian needs in the EMR put personnel at great risk. They are killed, kidnapped, and assaulted. Health facilities are destroyed, damaged, or taken over for non-medical use. Ambulances are looted, stolen, shot at, and blocked at checkpoints. There are electricity and water disruptions, fuel shortages, and besieged populations. Thousands die yearly, not as direct victims, but because the environment is too dangerous for effective healthcare to be delivered. WHO, with partners, is establishing a system to collect data on attacks on healthcare personnel, facilities, transport, and patients in complex emergencies. This will help identify patterns and find ways to avoid attacks or reduce disruptions to healthcare delivery.